Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 ATH Alice. Welcome to our weekly show. My name is Abby. I'm your Healthy Living NP. How are you guys doing? Please share the show. Please share the show. Welcome. If you're new here, this is our weekly show. And if you want our regular followers, welcome back. And as always, as you can see, today's topic is diabetes awareness. So, as always, my disclaimer, I'm a provider, but I'm not your provider, so please not make any changes to your regimen without checking with your own provider. So let's get this show started here. Let me get my banners together, and I will be in here. I'll be asking questions, go into comments later, okay? So if I don't get to your comments right away, that's why. But okay, so welcome, 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 welcome. Alrighty, so diabetes awareness. Alrighty, so let's get not sure here. This is not a comprehensive stuff, and I can't put everything about diabetes because it's such a vast topic. So I'm just going to touch on the main ones without making the show too long. Okay, so let's get into there. Alrighty. So what are some of the? Let's just do some of the stats with diabetes here. According to the Centers for Disease Control and Prevention, type 2 diabetes develop most often in people who are over age 45. And let me get back here. So everybody, I always want to go into all the different stats and all that to people. Like most people, like, oh, that's something else. But we all know somebody who has diabetes in our family, whether it's our family member or friend, and somebody who has like really bad diabetes that they're going through other complications as well. So this is for you who maybe you're a caregiver, maybe your spouse, maybe your parent, and all that. Okay, so it's just for everybody too. You may be somebody who want to teach people about diabetes, so this is for everybody. Okay, for a purpose of this conversation tonight, this is about type 2 diabetes. This is adult onset diabetes, but type 1 diabetes, I'm just going to touch on it a little bit because some people have people with family members or friends with type 1 diabetes. Okay, so let's get in here. Alrighty, just hold me 1 second because I'm going to make sure I'm closing on my screen. I want to make sure I open it up for everybody. Okay, so alrighty. So the scientific definition, diabetes is carbohydrate converted to glucose, then the pancreas releases the enzyme. Okay, so basically what it is, you eat your food, okay? You eat your food. When that food goes into your body, it turns into glucose, all right? When it goes into glucose, and then the part of your body, the pancreas, I think I talked to you guys about the pancreas, and when I talked about pancreatic cancer before, all right, pancreas is one of the organs that's in the abdominal area. Like I said before, you got your liver, you got your pancreas, you got your everything else, the gallbladder, everything. But the pancreas is right under your left breast area in that upper body there. Okay, let me just see if I can show you that. I think I have a picture of that somewhere here. So I don't want to make this show too long by going to pictures and all. So, but 1 second here. Thanks for watching again. So this is the body here, okay? So this is everything, like I said, when I talked about your area, your pancreas on the left side, your pancreas, the gallbladder, other thing over there. So your pancreas is right under your left arm that you see where I'm putting my arrow. Okay. So there's one that's the organ that makes the insulin. So you eat the food, it turns into glucose, and then it goes down there, and the pancreas is supposed to release the insulin. All right, it releases the insulin, and it goes, and then it breaks it up, goes into your body. It gives you energy for you to do everything. That works fine. You don't even need to know anything about it. It works every day if you don't have diabetes. And sometimes you may not know you have diabetes then. Okay, so that works fine. Now, the pancreas makes beta cells. So the beta cells are one that make the insulin, which is an enzyme, all right? For type 1 diabetes, all right, which is you get that when you're younger. Sometimes you get it very young, and children start developing that, early on in life. It used to be called juvenile onset diabetes too, right? So what happens is the pancreas, it runs out of the beta cells. Diabetes is also, type 1 is autoimmune, meaning that the body understands that, but the body sometimes it tricks the body into thinking we don't know what that is. There's something attacking us. We have to attack it and get rid of it. So it attacks its own self. And so type 1 diabetes, like autoimmune. I talked about that before. Alrighty. So it destroys all the beta cells. So when you make all this glucose, you eat the food, you make all this glucose, then you go down and the body's like, okay, pancreas, waiting, knock on there. Come on. This is what we do. We release the insulin, we break it down, it goes into the body, we get energy. That's how it's supposed to work. Well, in type 1 diabetes, there's no beta cells anymore. And then it just in the body, then that way you can make insulin and the body, that glucose just backs up in the body, backs up in the body, backs up in the body until you notice the child's becoming sluggish. They may be wetting the bed, they may be sleeping too much and all that because the glucose is building up in the body and there's nowhere for it to go. Then eventually, sometimes they may, unfortunately, they may pass out. They may be, you go wake them up in the morning, like in a deep coma and all. And that's when for anybody, you need to get them to the hospital as quickly as possible. Call 911 or whatever the emergency situation in your district, wherever it is, you call them and get them to the hospital as quickly as possible because they need to be put in the insulin drip right away. But for type 2 diabetes, you get that later on in life. Some people started getting in there as late as like early as in like 20s or so. It's, you start taking that, you still got the food, you still eating the food, it turns into glucose. All right. You get down there and the body starts, the baby's like, okay, let's go. Let's get this insulin going so we can get the food into the body, into the cells, and get this energy going, and we'll go on our merry way. Well, the pancreas like, okay, I don't have enough insulin this time around, so I'm just gonna be putting out a little bit. Well, over time, the glucose start building back in your body because it's not giving you enough. Let's say you're going out of state and you need like 10 gallons of gas to get to your destination, and you go to the pump, and the pump, which is the pancreas, then the pump says, I can only give you maybe by 3 gallons. You're like, well, I can't do 3 gallons to get to the other state. I can't, or the other city. I need all of that. Well, too bad. I can't make any more than that. And that's when you start getting into the diabetic status and all that too. You're going to need insulin from outside, from an injection and all that, or other medications to get you to where you need to get to. So basically, you do the glucose, you eat your food, it turns into glucose, knocks on the pancreas. How much we need the insulin? And pancreas releases the insulin. You go by your merry way. You get to a point, the pancreas say, I cannot give you that much insulin anymore because I'm not making that much insulin anymore. Then that's when you get into the diabetic stage. Okay. So I hope that was a little understanding for us, because sometimes it's kind of difficult to explain diabetes, because it's really difficult to explain sometimes, especially to a wider audience. Alrighty. So let's get to what we need to do. Alrighty. So what are some of let's go back to my banners. Please don't forget to share the show. So we're done. What is diabetes? Okay, so what are some of the risk factors? Alrighty. Let me go in here. So risk factors would be, most of the time it's like, ethnicity to Black, African American, Hispanic, American, Indian, Asian Americans, and all that. White people get it too, but it's just that you get it at a higher rate. Sometimes it's like based hereditary and also the kind of food that we eat. But when I do this, I do that to everybody. I take care of everybody, and every race has it too. Okay. Genetics. If you have diabetes in your family, more than likely because that's part of your DNA. So if you have like, first degree relative, your brother, sister, could be your parents and all that. Sometimes it could be somebody skip a generation or, but part of it is hereditary too, meaning that part of your DNA. So if your family member had it, usually I would ask that question, does anybody have diabetes in the family? And then that puts you at a higher risk of getting it. Everybody's at an average risk because you can still get it based on your lifestyle. And also as you get older, you're at a risk of getting it as well, and based on your lifestyle, but you had higher risk. All right. Overweight. And again, that meaning sometimes it'd be like if you're higher for your body frame. Okay, that's why I always tell people it's not just you just say, okay, this person's fat, so they're gonna get diabetes. I took care of people who are naturally skinny, a whole population of people who are naturally skinny, and they had a higher risk of diabetes too. So it's not just because you're fat, but or overweight or obese, all right, clinically obese, because we do the BMI thing and all that. But different, also abdominal growth, when you carry a lot of fat in your belly area, which is also when as a woman, as you get older, hormonal changes, you're going to have fat in your belly area. For men, as you also get older too, you get a lot of fat in the body area, and that covers the healthy organs down there too. That makes it very difficult for that insulin to go through when you eat to get to the glucose and to get into your body cells. So that's one of the risk factors as well. All right. If you were pregnant, gestational diabetes, Usually when you have the baby, your risk factor reduces, but some people go on to, from there and go on to having type 2 diabetes too. So that's one of the risk factors. Sedentary lifestyle. If you do a kind of work where you're not moving around that much, you sit at the desk, or you do any kind of job that you're not moving around that much, or your lifestyle just makes it that you don't move around that much. You come home, you go to work, you come home, you don't do any other activity during the day. People might say, oh, I move around at work and all that too, but it's not moving to where your heart is racing and you're burning fat and all that. So sedentary lifestyle, like they say, sitting is the new smoking. So you want to be able to get up at least an hour, move around. People will have like certain watches do they tell you it's time to get up, move around. If even 30 minutes a day, 3 times a week, you walk to the mall, you walk in the park, you have your treadmill at home, whatever it is, just try to keep healthy regardless of what age you are. Because some people think, well, I'm a little older now, so I don't need to do that anymore. No, that's also part of it too. Okay. High cholesterol. Again, I talked about high cholesterol before. The plaque in your bloodstreams, in your blood vessels, when that kind of plaques up there in the vessels, after a while, your blood pressure and all that. High cholesterol meaning you're not eating healthy food, so that also puts you at a high risk of not only diabetes, but also put you at a high risk of a heart attack and also stroke too. So that's why it's important to go to your doctor every year to get your blood work, and they tell you as often, especially if you're taking medications for cholesterol and all that. Okay. And age. Sometimes it's just a matter of you as you get older, as we all get older, you're prone to getting so many other different diseases. It just comes with the territory. All right. So, but it doesn't mean that. All right. Also, sleeping, you're supposed to be getting at least 6 to 8 hours of sleep a day, even if you're getting older. And for those of us who work in like stressful groups and all stressful jobs, it's very important to get that sleep, okay? Because your body is not, it's not resting and recovering, building new cells over and over. All right. So let me see. I don't see any. Okay, I'll get to that topic later. So we'll go in there and we'll get into the symptoms. Alrighty. So people say I say alrighty a lot. Sorry. Okay, let's get in there. Let me see. Oh, you're watching. Thank you all for watching. So now what are some of the symptoms of diabetes? All right, let's get in here. So you start when you get to a point where you start feeling what I mean, the 3 P's and all that. Okay, you're feeling more thirsty than usual. Like you find yourself drinking more water. You're supposed to be drinking more water anyway, so you can keep hydrated. It's good for the kidneys and all. Depending on if you don't have any other issues with your kidneys and also congestive heart failure, but you're feeling more thirsty than normal. Like you just drank and you're going back. Hopefully, you're drinking water, not alcoholic beverage too. Okay, nothing wrong with alcoholic beverages as long in moderation if you don't have a history anything like that. Okay. So, but you're feeling yourself, drinking a lot more, feeling more thirsty. And next one is urinating very often. Okay, peeing. You're peeing. Just came out of the bathroom. It's called polyuria. You go into the bathroom. You just pee. You came back. You peeing again. You go back again. You peeing again. That could also mean that you may have a urinary tract infection or something else is going on. If you're a male, it could be a prostate issue and all. But when we put everything together, we're looking at the bigger picture. So we're not just looking at one symptom over here, isolated symptoms. We're putting the bigger picture together. All right. So polyuria, that's when you're peeing a lot, and then polyphagia, extreme hunger, like you just ate. Some people are like they call themselves foodie, and some people have healthy appetites. Okay, there's nothing wrong with that, but you find it, you see like, wait a second, I'm eating a whole lot often, and sometimes you see yourself gaining weight, but not often. Not also again, like I spoke about, not everybody gains weight. Not everybody who has type 2 diabetes is a heavy set person. So you could be losing weight also. Again, when they do your blood work, they find some things in there. It's called ketones. So it's like the byproduct of everything that's going on. You're feeling very tired and weak more, and it's not your norm. Like your own body. There's something going on that's not your norm. Alrighty. You're feeling irritable, and sometimes it's like somebody talks to you and you just snap back at them. Or it's just that people are like, there's something different going on with her. You just talk to her or talk to him, and it's like, oh my God, he almost bit my head off. Alrighty, slow. You got a wound that's like very slow healing, especially like on your feet down there, your toes and all. You said, I don't know, wounds anywhere else in the body there. For getting also a lot of infections, you can have gum infections, vaginal yeast infections. Again, like I said, urinary tract infections, and also for people who are like black or brown colored and all, you get the back of your neck could be like get a little darker and all. So you one's like, okay, what's going on there? I mean, and then we'll start putting things together. And then that's when we say, okay, let's look into more. Let's do some blood work and see what's going on. Okay. So let me see. Do I have any questions there? All right. So we go, what do you do for a diagnosis? All right. So to simplify this, usually when we get to this and all that, we say, okay, let's do some blood work. The thing we'll maybe looking at, and sometimes you don't know that you have diabetes or these symptoms until you go into the hospital and they do your regular blood work for something else, and then they find out that, oh my God, we took your blood work this morning for something else, and we noticed that when we did your blood glucose level in the morning because you were fasting overnight to have the blood work done, or you go to your doctor's office and we did this to do your blood work and we saw your fasting blood work that it's not supposed to be this high in the morning. It's supposed to be like less than 100 in the morning. Why is it so much higher? Depending on what it is, could be less than 125 as well. So we'll be like, okay, there's something else is going on there. So we usually would draw like an A1C, and the A1C measures your blood sugar over a 3-month period. Okay. So let me go in here and see if I do my media. So when I put this up and everything, when you guys are watching this later, you can also pause and then look at here. So this is what we're going to be looking at. Alrighty. So we'll go in there and move that out of the way. Okay, that was your blood pressure there. Sorry. So the A1C, these are the levels that we're looking at. You can see here, normal is supposed to be, up to 5.6. When we say pre-diabetes, when the doctor tell you, oh, you're kind of borderline there, so try to eat a little healthy. That's 5.7 to 6.4. That's when you're pre-diabetic. All right. So that's when they say, okay, eat healthy, exercise, and we talk about your family history and all. When you get to 6.5, that's when that's when you're in the diabetic level. Okay. That's when we say you're diabetic now. And that's when your doctor will talk to you based on your history and all that and go on from there. Okay, the blood again, it's just you go get your blood work done, and you do that when you're in the hospital. That may see that they call incidental findings. They're looking for something else, and they find out that, oh, you may be diabetic. And some people also say, I don't like to do too many tests, because as soon as you go for a test, the next thing you know, they find something that they don't need to be finding. But that's important, because a lot of people walking around with really high A1Cs, and they don't know. And sometimes, somebody might come in, I said, let me just do your routine blood work. And the blood work, and I'm like, you were like, like kissing Jesus' feet or whatever your higher power is, or the universe was about to take you out, because these numbers are very, very high. And depending on the number, because when you get to like 6.5, sometimes they'll say eat healthy, exercise, and then come back in 3 months, we'll take it again. If you're not symptomatic and everything else not going on, like your kidneys and cholesterol and other things not going on, we'll say go eat healthy and then come back and we'll check it again in 3 months. Sometimes it's still the same. Sometimes you're lucky enough and it goes back, because you can reverse type 2 diabetes depending on where you are and your lifestyle and where you are when they tested you initially. All right. So they'll tell you go eat healthy, exercise, and then we'll start you on the medication. Again, we're looking at your kidneys, because the medication that we start off first, you may be allergic to it, or your kidney numbers may not be to where we need to do that. Okay, and hold on one second, I'm talking too much. So the generic name is like metformin. All right. So I usually don't like to call medications on yet, because then they'd be like, wait a second, she said this and said that and all. Again, like I said, I'm not your provider, so check with your own provider first. Okay. And then depending on that A1C, if it starts off the first time we did A1C and you're like at 9, you're going to start on insulin or one of those other medications where you can do once a week or so. Don't go from there, because we want to get you down. If you're diabetic now, we want to get you down. When we say it's controlled, we want to get you down to 7. All right. So if you're controlled, we want to get you down to 7. Also, your blood pressure and everything else and all that. But if your numbers start really high, they're going to start you on insulin and then try to build it down and eat healthy, exercise and all. Okay. So it's important that you do that, because you can run into complications and all if you don't eat healthy and you don't control your diabetic status. All right. Again, like I said. All right, so we'll go in there. I talked about the diagnosis. So our next phase here, let me go back to my banners. Okay, so again, we talked about the treatment, like I said, depending on what your A1C would be, your doctor, your provider would decide this is how we're going to do the treatment plan. Again, looking at the bigger picture, looking at what do you have, high risk for stroke, because maybe one of your parents had a stroke or your brother had a stroke. So the doctor can say, you know what, let me just start you with this medication, at least eat healthy. And you always have to get your A1C checked again every 3 months anyways. If it's not normal or if it's not controlled, you may have to check every 3 months until they get to where they get it controlled. All right. So you can say, you know what, I'm going to take the medication and I'm going to eat healthy and all that and change my lifestyle. It's important that, everybody in your house is also eating healthy. Again, like I said, you can't be sitting out there eating your heavy pampata rice and then somebody's eating salad. That's not going to work. Okay. And doesn't mean when you're diabetic that you only have to eat salad. You can make wherever country you're from, you can make that food healthy. Okay. So let me get in here. So the problem is, and it's very important. Diabetes is very important that if you are diagnosed with it, it's not something to ignore. It's not. All right. And it's not something to be too afraid of, but it's not something to ignore. So please listen to me when I tell you that it's not something to ignore. All right. Because if you don't control, if you don't take your medications like you're supposed to, and you still have to eat healthy, you still have to exercise, you still have to stay as active as possible. If you don't do those things over time, it's going to take a toll on your body, and very expensive toll on your body too, and also your whole family, your lifestyle, your job, and everything. Okay, I'll go back to it. Diabetes is the number one reason for traumatic, non-traumatic amputation, meaning you see people having their toes cut up first, and then they start moving up the leg, start moving up and moving up until the whole leg is amputated. Okay, when I said non-traumatic, meaning you went in an accident, car accident, or some kind of job thing that caused you to lose your leg. So it's very important. Also, the number one leading causes of adult blindness too. So it's very, very important. Okay. So what are some of the complications? Like I said, if you don't take care of it, you get the cardiovascular disease. I talked about, high cholesterol, it stiffens your arteries, it makes them harden, and then the blood flow cannot go through completely, and all that also affects the heart. That can also lead to a heart attack or a stroke. So you have to control that. You have to control your blood pressure if you have that, because it's the blood pressure, the hypertension, which is the blood pressure, diabetes, and also kidney disease too. Okay. And also nerve damage, because it goes after the major arteries and go have major blood vessels, and it also goes after the little blood vessels too. But they're all very important blood vessels. When you start having a numbness and tingling, like pins and needles in your nails, in your fingers, and all that, in your toes, and all that's what we call neuropathy. That also affects that. And when it starts affecting it over time, now it leads to the impaired circulation, meaning your blood is not flowing. Again, that's what leads to you sad state. You have to like take out your toes and moving back and forth. So you can see how, if you're like an adult who's working, or married or unmarried, or parent or whatever, you can see, because you don't want that affecting you to where you're going to be losing your ability to work, ability to be able to live a decent lifestyle and be able to take care of yourself and your family. Okay. So it's important. And of course, if you're diabetic, you're going to be following up with a podiatrist, because they tell you at least once a year you have to see the podiatrist. And if you see anything going on there, if you have any problems going on with your feet and all that, if you're diabetic, you're not supposed to be walking around with no shoes on. You're not supposed to be walking around just with socks on either, because if you're, you don't feel that much, you start losing the sensation to your feet. And if your foot get caught on something, bump on the furniture, or something that gets into your feet, especially if you're walking outside, but also when you're inside too, before you know it, you don't know that's there, and you get a little sore, and before you know it, is worse than what you thought it was going to be. Because for somebody who's got good circulation, that may heal up. But if you don't even know that it's there, that's what it's important, that every day as a diabetic too, you want to have a mirror with you. You put that mirror down, you look at your feet. You want to do a quick examination of your feet. Even if you can do it every day, try to do that at least every other day or so. But most important, don't be walking around with no shoes or no socks on. Okay. And seeing the podiatrist. The podiatrist is a foot doctor. You want to see a podiatrist every year and as often as they tell you to, because let's say if you start to do more testing to see how the circulation is, the podiatrist does more than just not say, oh yeah, I'm going to go get my nails done. They do much more than that. Okay, because they're trained medical professionals. All right, so that's called neuropathy. All right, and kidney damage, that's called nephropathy, because it goes after the kidneys too. Some of the medications for diabetes also can affect the kidneys, but again, you're getting your blood work done every year, every 3 months or so, every 6 months, depending on what the results were before. And your doctor will tell you, okay, we maybe change some of your medications around. We maybe to try something else and all. Don't say, oh my God, I don't want to take this medication because it's going to do this. You're going to need the medication, but you and your doctor will look at your medical history again and decide what is best for you. Your care will be tailored to you. So a lot of people come in on Facebook, and everybody's, they think they can just Google everything, and all of a sudden they have all the answers. They don't have to listen to medical professionals. There's a whole lot of things that we do in the background, nuances that you don't know just by watching Google or clicking on AI. AI tells you this, and you're like, oh, I'm good. I don't need no medical professionals. Yes, you do. The same way I can click on Google and say, this is what's going on in my car. I don't need to go to the professionals. No, because they know what they're doing. All right. We've gotten to a place now in society where it's like people who are educated, Nobody cares about that anymore. We can just sit there and just Google stuff. There's a lot of things that go be on what's on Google. And again, like I said, when you watch, you have to be careful what sites you're going on to get this information, because there's confirmation bias. Anybody can put anything on there and you'll say, oh, they agree with me and I'm moving on with that. Okay, it's your life. That's why I tell you, I'm a provider, I'm not a provider. You should be checking with your own provider, not Dr. Google. All right. Yes, we want you to be informed. I tell you all the time, look on Google for certain kind of medications or certain diets and all that too. But at the end of the day, you still have to follow up with your provider. Okay. So it also goes after your eyes. Like every time when I come on here, I tell you guys, making sure you see your eye doctor at least once a year, depending whether you have diabetes or not, but like high blood pressure, but especially if you have diabetes, because it goes after low blood vessels. And again, like I said, diabetes is one of the leading causes of adult blindness. So again, you don't want to sit there and get to where you're blind and you can't take care of yourself, and you have to be completely dependent upon somebody to do that for you. For some people, they don't have any problems with it, but losing your sight is a major, 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 major lifestyle change. Okay, so make sure you go into your eye doctor to get your eyes checked at least once a year, and your eye doctor will tell you how often they often want to see you, because sometimes some people go there and then they, for other reasons too, and the doctor, they have to do more testing. Okay. And I also talk about the foot damage to the nerve damage that leads to amputation. Also, for skin, you could be prone to more infections. Like I said, poor wound healing, gum infections too, because you go to see a dentist and your dentist might say something's going on there. All right. It also affects your hearing over time, and type 2 diabetes, because again, it affects the blood vessels, and all, you're not getting enough sleep, you're not resting, recovering. It can also lead to Alzheimer's, dementia. There's different types of dementia too. Okay. And depression, of course, because you're dealing with all that. You didn't miss a whole lifestyle change. Again, like I said, and for men, erectile dysfunction. You tell men you may do this, you may do that, you may do that. You talk about erectile dysfunction, and they're like, oh, okay, well, let's get this diabetes thing, because we got to be able to work that other body organ. And it may seem funny, but that's a lifestyle. It's part of life. You in a relationship or whatever it is that you're doing, you want to be able to be intimate with your partner. All right. So that affects women too. Again, like I said, frequent vaginal yeast infections and all of that. So it's an important disease. It's a very serious disease. And when one person has it in the household, it's important that everybody is supportive of them. Okay, it changes the kind of way you eat your food. Like I said, we eat our Liberian food. You can make it healthy. You can eat brown rice. You can eat buggerweed with your stuff. You can, more meat from the ocean and less on the sea. So you want to be, if you're gonna be chicken, low fat chicken and all that. We used to eat like the regular chicken. I think it was like country chicken in America. We used to buy. What's it called? I can't remember. But after a while, it was so bony. And like, oh my God, there's no flesh on this thing. It's not even good. So it's important that you eat. Don't eat too late at night. Don't eat, especially if you're working. You work like 3 to 11, or if you come home late, don't eat late at night, because when you eat late, that food has nowhere to go, because you're not exercising after that. You're going straight to bed. So all that fat is just going to your body and is staying on your body. Exercise, like I said, if somebody's diabetic in the household, making sure that everybody's eating healthy, because their kids might be oh, I don't want to eat that, but that's their future too. So make sure they're eating healthy. You don't have to eat salads all the time, but just kind of, mix it up. And I talk about, it's like, oh, you're talking against African food, or you're talking against Liberian food. No, because we said the same thing to people who eat pasta and potatoes and all those different food and white bread. You can make it wheat bread. You don't have to eat all those things all the time, but just make it, it's like a lifestyle change. It's not a diet, it's a lifestyle change, because it's either that or, TikTok, TikTok, TikTok. Eventually you're going to start getting into complications and all. And sometimes, even if you may be doing all of that, you may run into complications, but at least you're going to prevent it. You're going to delay as much as possible and be able to like manage it. All right. So making sure you're following up with your eye doctor, making sure you're following your family doctor so you can get your blood work every week, every week, every year, or as often if they have to change the medications around. Because again, you can reverse diabetes, or you can also lessen the amount of medications you have to take for that. And some people, like the doctors, will be like, okay, you know what, your numbers are good. We'll take you off these medications and just do a lifestyle change. Okay. So that's where you want to be, but you may not be lucky to get a lifestyle change. It's not the end of the world, but you just have to like deal with it. As with everything, as we get older, things happen, life happens, and you have to deal with it. Okay. I hope I didn't talk too long. I didn't want to make this more than that. So let me see here. I don't know this. question here. Okay, it was just, let me see. Victoria Morris is awesome work. Thank you very, thank you. Victoria, thanks for watching. So yeah, I know it's like been 30 minutes and it's like you're talking about healthcare and but anyways, but thank you all for watching. Again, like I said, eat healthy and get your blood work done and go to your family doctor every year. Even without the diabetes, go get your blood work done every year, so at least they be looking at your numbers and seeing and say, oh, wait a second, something's creeping up there and all that. You have to get blood work in outpatient setting. You have to fast first and then get the blood work, because we're looking at the numbers when your body's empty without any food. And sometimes if you go to the hospital or something else, they find it there. Don't say, oh, I didn't come here, you're always looking for something else. I don't want to go to the doctor, because they're always looking for something and they'll find something else. Trust me, we as medical professionals too, we are also nervous about going sometimes. Okay, so it's not, oh yeah, you guys go there and everything's healthy. We are also patients. Like I always tell people, we are also patients too, and we also get nervous because our lifestyle will change too if something happens as well. Okay, so I don't see. Did I see another questions here? Jackie Jackson, great topic. Thank you. Thanks. Thanks for watching. Thanks for watching. Please don't forget to share. So I thank you all for watching. I thank you all for watching. And again, like I said, if you look down on the forum, if you don't see some videos there, Facebook's like removing all the videos and putting them on well, they're removing the videos. But I also have Abby Tyler's Healthy Living page. I also have it on YouTube too. So you can just look it up there. And please, if you do look there, please become a member too. Just hit the notification button and hit the follow button so you can become a member, because I'm trying to, grow my YouTube page. But I thank you all for watching. And if you have any questions or comments, please leave them below and I'll be answering them during the week or so. All right. And again, I do Abby's Daily Dose during the week, little shorter videos here and there. So if you're watching from Focus in Liberia or from YouTube and you're not a member of Abby Tyler's Healthy Living page, please look there. This is the sign right there. Make sure it says Abby Tyler's Healthy Living page. And then just click on there and hit the follow button, hit the like button, and bring all your friends over. Just click it and invite all your friends. I'm trying to get everybody there. Just the way how you guys watch all the entertainment shows, do the same thing for me too, okay? And plus, I'm doing that. But thank you all. I really appreciate it. And I appreciate all of you coming on every night, every weekly night, and also Abby's Daily Dose too. So give me a like and share the show. Alrighty. Thank you all, and you all have a beautiful night. Good night.